Rolling up their sleeves and getting their COVID vaccine as Maryland races to vaccinate elementary school-aged children. How the state is making those doses available to all families, and school systems will play a key role in this vaccination process. This morning, we check in with area school leaders about what this means for controlling potential outbreaks. Hi, everyone. I'm Jason Newton. Welcome to 11 TV Hill. And these vaccines are filling a critical need. A high number of Maryland's new COVID-19 cases are in children younger than 10. According to the state, in the beginning of 2021, 6% of the state's COVID patients were younger than 10 years old. However, in the last 2 to 3 months, that population accounts for 14% of new cases. Starting today, those doses are now available at both CVS and Walgreens locations. Later this week, more clinics will open in Baltimore City, Anne Arundel, Carroll County, and Harford County. And joining us now with more on Maryland's plan to distribute those vaccine doses is Deputy Health Secretary Dr. Jenlene Chan. Thank you for joining us this morning.
Good morning. I'm glad to be here.
This sounds like something that's been in the works for quite some time for Maryland, and now the day's arrived for those 5 to 11-year-olds. Just tell me about what went into this.
So, I've been meeting with our pediatric planning team for months, anticipating that this day would arrive. And, of course, we started convening as we were anticipating the vaccines to be approved for the 12 to 15-year-olds, which happened back in May. And that got rolled out over the, late spring into the summertime. And, really, even since then, we've been talking about this vaccine for the next age group, the 5 to 11, and when is it going to come? And so we've been talking with the Maryland chapters of the American Academy of Pediatrics, as well as the American Academy of Family Physicians for months about how do we prepare providers, how do we get them enrolled, the ones that are still not enrolled, training them, providing information about storage, and management of the vaccines to, work with the local health departments and how do we roll it out to this next age group down, because it is a little different and engaging school systems. So there's been a lot of planning for a number of months and, really ramped up over the last, month and a half as we, as the company, as Pfizer submitted their application and their data. And then certainly in the last few weeks, as we were getting more information about doses available to the state and the ordering and that process really began to crystallize.
How will the rollout work? Because there are many different ways you can go between the providers and pharmacies and schools. What should parents be looking forward to as we get to the state?
So, as we got more information about a month ago from the CDC in terms of what, how many doses were available to the state, what they're starting out at, because this is a different vaccine in that it's packaged differently. So they are sending it to us in allocations. So we got information about how much the state would be getting initially, and we were able to put in some pre-orders. And so we prioritized, the people that we think will get the vaccine out. So that includes local health departments, as well as the pediatricians and family practice offices. And so we highlighted those and prioritized getting doses and really wanted to activate as many providers as we could. We did a survey of providers asking, how many doses do you think you can use in the first week, and got that information, factored that into our planning as we put in the pre-orders.
Geographically, is there a way that you're looking at what areas should get attention first, or is it even spread? How about that?
We wanted to make sure that across the state there was availability of vaccine. And so we really looked at, where the population lives, for that 5 to 11 age group. We think we have about 515,000 kids who are between the ages of 5 to 11 around the state. And of course, they're distributed differently. So for counties that had a larger population, they got more. Those that have a smaller population got a little bit less. So we try to distribute that, but that was really in the pre-ordering phase. We anticipate, next week we'll get another allocation and we'll start putting it where the demand is high, where there is a need. And so that will change over time.
Of course, there'll be some folks who are still on the fence right now, trying to decide if this is right for their kids. Give me an idea of your thoughts when it comes to this being safe and effective for that 5 to 11-year-old range.
With the trials that involved a few thousand kids in that age group, that was the first and foremost was, looking at safety. And that's really been the case across all of the different vaccine trials. And so, what we've heard about with Pfizer and people have heard this is that there are side effects after they get the vaccine. And so even among adults, it was the soreness in the arm, redness and swelling. And so they saw some of the same things among kids as well in this age group. In addition, there are some other side effects. So people can see in their kids, a mild fever, some tiredness or fatigue, muscle aches and joint aches. And those usually go away within 2 to 3 days, which is what other people have experienced, even among older kids.
All right, well, away we go for this 5 to 11-year-old group. Looking forward to see how this all turns out for the state of Maryland. That's Dr. Jinling Chan. Thank you this morning.
Thank you so much.
Yep, have a good one. And we know that a lot of parents want to know exactly where and when their child can get vaccinated. We have a complete list of each county's plans and vaccine clinics on our website. It's WBALTV.com and our mobile app as well.